Hello. Today we're here to talk about acupuncture for the treatment of rheumatic conditions, otherwise known as B syndrome, presented by Angie Hughes. Angie covers a wide range of topics today, including understanding bones, joints, muscles and sinews from a 5-element and traditional Chinese medicine perspective. She looks at the function and decline of kidney essence and how this influences aging, and also the look at Wei Qi and pathogenic invasion, and when these are compromised. Rheumatic and pain conditions, according to Chinese medicine, are considered B syndrome. So Angie explores the onset, causes and environmental factors, as well as the differentiation between different B conditions: tendon B, muscle B, bony B, chronic B, wind B, cold B, damp B, and heat B. She looks at treatment protocols and techniques for these different types of conditions and goes on and explores these using case studies. It's with great pleasure I introduce to you Angie Hughes. Angie Hughes has been practicing acupuncture for over 20 years. She studied acupuncture at the London School of Acupuncture and Traditional Chinese Medicine in the United Kingdom, graduating in 1989, and moved to Seattle in 1997 to join the faculty of the Northwest Institute of Acupuncture and Oriental Medicine. Before studying acupuncture, she worked for 7 years in a psychiatric hospital rehabilitation program. During her many years working in the health industry, she's had the opportunity to work with many different populations, including running a community acupuncture clinic, and has specialised in the treatment of elderly residents in a Seattle hospice. In addition, she supervises a student program treating survivors of torture and trauma at a refugee clinic. She currently teaches for Bastyr University, Seattle as a clinical supervisor and instructor. I'm now handing you over to Angie Hughes. Enjoy this webinar.
I'm Angie Hughes, and I've been teaching and treating in a nursing home setting for the last 17 years doing acupuncture. I graduated from the London School of Acupuncture in 1989, and most of my practice over the last probably 25, 26 years has been either treating the elderly or treating people specifically with chronic conditions, especially chronic pain. One of the most common things we see in the nursing home setting is arthritis, and in TCM we know that to be B syndrome. So we're going to be talking a lot about this today, but first I want to just talk a little bit about rheumatology in general and how it's seen in TCM. So in terms of the relationship between the anatomical structures of the body, let's look at TCM and 5-element theory. So it says that the skin belongs to the metal element and the lungs, and the flesh and the muscles belong to the earth element and the spleen. The vessels belong to the fire element and the heart. The sinews, the tendons belong to the wood element and the liver and gallbladder. And the bones belong to the water element and the kidneys. So as we age, the decline of all the Zhang and Fu are going to have consequences to all the mentioned tissues of the body. So, but for today's purposes, I want to be mainly focusing on the bones, the muscles, and the sinews. So let's get back to a few basics about TCM. So the bones belong to the kidneys, in that it's the kidneys that produces the marrow, and bone is one of the curious organs. It contains the jing, or the kidney essence. The bone in Chinese medicine represents the frame, the structure, and soul. It's like the durability of the body. And in TCM specifically, it includes the spinal cord and all of the joints. So let's talk a little bit about the functions of the kidney essence. It's a combination of both the pre and the post-heavenly qis. If you remember, it can be replenished by the post-heavenly qi as long as the spleen and the lung and the stomach functions are working correctly. It's a substance which is the basis of all physiological processes. The essence is stored in the kidneys, but it's actually circulated by the 8 extra vessels all over the body to supplement the qi and blood that flows through the regular channels. So the amount and the health of the kidney essence determines the reproduction, the growth, the development, the health of the bone and the bones and the teeth, the hair, the brain, and the integrity of the spine, the spinal cord, and the joints. And the health of the essence specifically determines our ability to heal from damage to the bones and the tissues, as well as our ability to correct any kind of organ damage or deficiency. So the kidney essence is the basis of the qi, the yin, the yang, and the blood. And it's more fluid-like, and is so therefore seen as part mainly of the kidney yin. It is, in fact, it's the material basis of the kidney yin. The kidney essence is also the basis of the marrow that fills the spinal cord and nourishes the brain. So therefore, when the essence declines naturally over age or prematurely in some cases, our potential for tissue and bone healing is greatly diminished, and as well as our brain, nerve, and general neurological functioning. They become compromised as the kidney essence gets depleted. So because the essence is a combination of the pre and the post-heavenly qi, the decline of these functions can be slowed down with attention to diet, appropriate exercise, and breathing. And the way we do that is we cultivate the postnatal qi part of the equation, because the prenatal qi, obviously the jing, is a fixed amount. So we can't actually affect that, but we can by keep making sure that the spleen and the lung and the stomach qi is working effectively to bring in new qi and new blood. So this is why when we're working with the elderly with chronic disease, one of the main focuses is to put emphasis on strengthening the spleen and the stomach and the lung rather than pulling on the kidney, which maybe doesn't have much potential anymore. So getting back to rheumatology, the bones and the joints are under the influence of the kidneys. Guanjie is the translation for joints and means a barrier or a gate. It can also be seen as a node. Think about a bamboo shoot node. The joints, by virtue of their structure, are natural obstacles to the circulation of qi, so they can easily become obstructed by pathogenic factors. The main ones that create a rheumatological pattern that we're going to be talking about later include wind, damp, cold, or heat. But the joints can also be affected simply by a lack of lubrication, i.e. the decline of the liver and the kidney yin. So the spleen and the liver blood and the liver yin also play a role in ensuring the strength and mobility of the joints and the surrounding tissues. So specifically, the muscles belong to the earth phase, as we said, and the spleen brings the essence of the food to the flesh and the four limbs and the muscles. A lack of nourishment from spleen qi deficiency is going to cause the muscles to waste, and it's also then in turn going to affect the other structures around the joints. The sinews belong to the wood phase and the liver and the gallbladder, and are fed by the liver blood and the liver yin. The nature of the wood in general is to twist and straighten and expand, and it's characterized by flexibility. It's the yin and blood of the liver that allows the sinews and the muscles to be flexible and to move smoothly. A lack of liver yin and blood is going to lead to rigid, tight, weak tendons and ligaments, and eventually it will lead to stiffness and spasms. So the joints, the muscles, and the sinews are all susceptible to both internal and external pathogenic factors. The external pathogens include the 6 pernicious influences, or better known as the 6 evils: wind, cold, dampness, dryness, heat, and fire. So under normal circumstances, if somebody is pretty robust, the body can withstand an invasion of these pathogens. But when either the wei qi is compromised, or as we've seen above, like if the kidney and the spleen, the liver, yin, and blood are in decline for whatever reason, the joints, the bones, the muscles, and the tendons are going to more easily get invaded by external pathogens. And then that leads to obstruction, causing pain, spasm, swelling, or a combination of the above. So talk about rheumatism in general and pain according to traditional Chinese medicine. So the concept of rheumatism in Western medicine includes the bones, the muscles, the sinews, and they share pain as the main symptom. In TCM, the collective name for this is B syndrome. The word B means painful obstruction, and the symptoms of B syndrome can range from pain that can just kind of present being sore or achy or heavy to really severe stabbing pain. It can also cause numbness, tingling, or paralysis. Distension and stiffness, limitation of movement. These are all, they come under the umbrella of the symptoms of B syndrome. It's seen as a chronic, progressive, degenerative disease, and it often presents with frequent relapses. B syndrome usually starts gradually. It begins with an invasion of a pathogenic factor, and at this stage there may be fever, sweats, or general signs of an external invasion, and then later there'll appear the painful muscles and joints. When we think of B syndrome or any kind of painful obstruction, we generally think of excess conditions, but B syndrome can be due also to a deficiency of the Qi blood or the yin and the yang, or just as a result of a malfunction of the organs, poor function of the organs, which can then lead to a malnourishment of the tissues, the tendons, the muscles, and the joints. In deficiency cases, the pain's going to be duller and not so severe as in excess cases. Most people presenting with B syndrome present with a combination of both excess and deficiency. One of the differentiating factors of B syndrome from, say, Wei syndrome is that B syndrome always presents with pain, and the pain tends to be influenced mostly by weather changes. Whereas with Wei syndrome, for example, it's usually a purely deficient nature. It presents with numbness and atrophy, but there's no pain per se, and there's no relationship whatsoever with the weather changes or any kind of changes in barometric pressure. This is specific more to B syndromes. So in clinic, the most commonly seen examples of B syndrome are arthritis, both rheumatoid and osteo, bunions, DJD, tendonitis, bursitis, sciatica, lupus, scleroderma, mixed connective tissue disorder, polymyositis, psoriatic arthritis, gout, ankylosing spondylitis, polymyalgia, fibromyalgia. B syndromes can be differentiated either according to etiology, like the invasion of the pathogenic factors, or by the level or stage of invasion. So in other words, where in the body the pathogenic factors have settled. We're going to talk more about the pathogenic factors in more detail in a minute, but I just wanted to talk briefly about the different levels or stages of invasion. So when the body's been invaded by one, or in most cases, a combination of wind damp cold or wind damp and heat, if the pathogenic factors are not expelled, they can invade to the interior, attacking the tissues initially and then possibly their associated organs. The most commonly seen examples of B syndrome are tendon B, muscle B, and bone B, although the blood vessels and the skin can also be subjected to B syndrome. But let's talk about the tendons, muscles, and bones. So the tendons, when you get a B syndrome of a tendon, or as we call it, tendon B, this brings about symptoms of pain and weakness in the tendons and the joints. The joints can flex, but they can't extend. Think of trigger finger or Dupuytren's disease as an example of this. The wind, cold, and dampness invade and lodge in the tendons. Because the tendons belong to the liver and the wood element, there may be over time associated symptoms of liver yin deficiency or liver blood deficiency. Or it could be that the liver yin deficiency may have caused a tendency for the pathogenic factors to lodge in the tendons in the first place. So it kind of works both ways. Muscle B is a lot more common. It deals with the lodging of a pathogenic factor at the level of the muscle tissue. An invasion of wind, cold, and damp will give rise to pain, numbness, stiffness, and heaviness, and possibly a lack of strength in the forelimbs. Prolonged pathogens lodging at the muscle tissue may then block or suppress the function of the spleen, causing fatigue, lethargy, and digestive issues. The last stage I want to talk about, which is the one I see the most working in a nursing home, is bone B, or bony B. It comes with pain in the joints, impairment of movement, and structural changes in the bone. We'll talk more about this later on. When treating, for example, the elderly with recurrent episodes of B syndromes, the obstruction of the channels will probably have already done damage to the qi, the blood, the kidney and liver yin, and the kidney essence. It's essential that with all pathologies within this population to focus more on tonification than excess. This is particular to like an older population. When you're treating relatively recent cases of rheumatism or arthritis, the treatment principle is more to expel the pathogenic factors like we usually do with pain, is to focus more on the excess, clear the heat or the cold, restore the flow of qi and blood in the channels. But in the case of more of a chronic B syndrome, like bony B, is often seen in like more of an elderly population, the focus is to restore the kidney and liver function, the yang, and to nourish the yin and the blood, and keep the qi and the blood circulating. So in terms of treatment planning, it's a lot more effective to treat somebody frequently, as they don't have the momentum to keep the qi circulating. This is like when we're talking specifically with the elderly, more frequent treatment is necessary than in a younger population, because they don't have the on qi that keeps things moving, and they don't have the lubrication of the yin, of the kidney and liver yin. So they might only get relief for like a couple of hours or maybe a day or so. So you got to figure that into your treatment planning when you're working with this population and when you're working with more of a chronic situation. So let's talk more about the mechanism in general. So the pathogenic influences mentioned above that we talked about before take advantage of either a temporarily or chronically depleted Wei Qi. They invade the body, causing a blockage in the channels and a malnourishment of the muscles, the tendons, the bones, and the joints. Initially, the pathogenic factors invade the skin and penetrate and obstruct the network of the connecting channels and the muscle channels before they reach the main vessels, causing more muscle pains than aches. The connecting channels trap the pathogens, but eventually, if the pathogen overwhelms the body's defenses, they may penetrate deeper and settle into the joints. If a person's yang is deficient, he's more readily invaded by wind, cold, and dampness. If a person's yin is more depleted, the yang qi is excessive, and the first pathogenic buildup is going to be heat, which is going to cause a pattern of wind, damp, and heat obstruction. People with strong defenses may also be subject to an invasion if they're exposed over a long period of time to cold, damp, or humidity. So, I mean, even like young people, if they have like a basement apartment where the walls are wet or damp, they could still get, their Wei Qi can be overwhelmed by a strong pathogenic factor, or like from being exposed over a long period of time. So the chronic obstruction of the blood and the qi can eventually cause a condition called blood tarring. This is a combination of stasis of blood and dampness, which then congeals into phlegm. The blood stasis and the phlegm penetrate the bones and the joints, and they cause the deformities that you usually see on people who've had chronic rheumatoid or osteoarthritis. This is the later and deepest stage of the pathogenic process. As we've seen, B syndrome is a slow progressive disease, and in some cases, a person may recognize the onset with external signs and symptoms like a sore throat, fever, but in most cases, the onset is insidious. Because the nature of wind invasion that represents the first stage of the pathological process, the pain at the onset can move around, because wind usually is characterized by a moving kind of pain. We're going to talk more about this later on. The pain at the onset it moves around, it can come and go, and in severity, but eventually it'll progress to becoming a fixed location and have relapses happening at specific times, especially when either the weather turns cold or if there's dampness. Eventually, the blockage of the channels will cause a malnourishment to the surrounding muscles and bones and sinews, creating that mixed pattern of excess and deficiency, mainly of the liver and kidney. I want to look at some of the etiologies of B syndrome. So firstly, trauma to an area can contribute to B syndrome. This can be an acute trauma or a damage to an area that happens over time, so like say from poor posture or from overuse of a certain area of the body. So an injured area sets up a weakness that can later then be susceptible to an invasion of a pathogenic factor. Think about sites of old sports injuries that later in life get aggravated with weather changes or overuse. Overuse of particular muscles and tendons or parts of the body, or underuse as well as poor posture or poor ergonomics, can also cause a weakness, leading to an invasion of pathogenic factors. Underuse specifically can cause weakness in the muscle tone, which then doesn't support the surrounding structures. Underuse can also cause sluggish qi and blood circulation, with resulting poor nourishment of the structures of the body, and eventually underuse of muscles or lack of exercise is going to damage the spleen qi. Severe or prolonged emotional stress can also be a cause of B syndrome, or a kind of damage to the, especially the tendons and the musculature, by causing a chronic tightness or like a chronic muscle spasm. This will inhibit the circulation of qi and blood, causing stiffness and a mechanical deficiency, and again creating a weakness that could be susceptible to a future invasion of a pathogenic factor. So I want to move on to talking about the pathogenic factors in detail. As we've said, the usual pathogenic factors include wind, cold, and damp, or wind, damp, and heat. Depending on the balance of the pathogens, one pathogenic factor may be more dominant, bringing a tendency to a certain group of symptoms over another. Wind is the bringer of most evils. It brings all the other pathogenic factors into the body. It can actually stand alone as a pathogenic influence in itself, or it can bring with it cold and damp, or damp and heat. Wind can be internal or external. Wind bee can also be called sing bee or walking bee. The characteristics of a wind dominant bee are that this pathogen is erratic. It arrives and disappears. It disappears abruptly. So temporarily, it will take advantage of a weakened wei qi. It penetrates the skin, the muscles, and then eventually the channels. The characteristic of wind attacking the muscles and the connecting vessels is that the pain moves around. It's mainly, but not always, found in the upper body, in the neck, the arms, and the upper torso. The pain that wind brings can be like of an achy nature, but it can change abruptly in quality, and it can sometimes be dull, sometimes be sharp. It can bring numbness. It can basically, there's like a whole host of different sensations that can occur with wind by the nature of the fact that it's forever changing. It can bring stiffness. Think of a stiff neck when you've been kind of lying next to an open window and you get what we call a wind attack. So that's basically a symptom of the wind penetrating to the muscles. Sometimes at the onset of the disease, there may be fever with an aversion to wind, but not always. In cases of mainly wind being predominant, the pulse is going to be floating and the tongue is going to possibly be unchanged. So the treatment principle here would be to expel the wind, unblock the channels, and promote the circulation of qi and blood. So at this level, cupping is indicated. Points specifically to expel the wind from the body, especially the upper body, would include DO 14, DO 16, gallbladder 20, lung 7, Sanjiao 5, Li 4, UB 11 and 12. These are mainly for wind effect in the upper body. UB 17, DO 20, Li 11, and DO 14 would be for wind heat B. Gallbladder 34 you could use for the spasms that come as a result of wind. And gallbladder 31 you can use for wind B and the lower leg. So along with the points, all these point prescriptions I'm going to be talking about, we're going to be talking initially to use points to expel the pathogenic factors, but we can also choose, along with the treatment protocol, we can also choose a combination of local points to the affected area, barrier points, Qi cleft points, shoestring points, Jing River points. We're going to talk more about these specific point combinations later on. Wind can also come from the interior of the body. It usually arises from a deficiency of blood or yin, and if it's internal wind, it's going to be more of a gradual onset of symptoms. And it's usually accompanied by painful spasms, tics, or contractions. Think of something like Bell's palsy. So the body's decline of qi and blood and yin that leads to internal wind can make the body itself more susceptible to an invasion of external wind. Causes of internal wind include liver yang rising, when the yin is not being able to hold the yang, and then the yang rising, it kind of brings a flurry of wind, causing spasms and stiffness and tremors. And it's like it's like an agitation. The way I like to think of this is that if you're in the London Underground and you've got this kind of vacuum, and then a train comes in, and as it pulls out really quickly, you get this flurry behind of like crisp packets and candy wrappers, or toffee papers as we call them. So that's like the kind of the way that the liver yang rises, and it kind of sucks up the wind behind it. Heat, extreme heat, can also cause internal wind as it burns up the yin in the fluids. And this could come from like a high fever. Yin and blood deficiency obviously can cause internal wind, causing a contraction of the limbs. And also the drying of the blood that happens in the elderly. This is really common, you see in a nursing home a lot, where the actual yin of the blood becomes exhausted. So the blood stagnates really easy, and the skin and the muscles and the sinews and the bones become really malnourished. The hair falls out, the skin becomes dry and itchy, and like you get like a leathery quality to the skin. So if you have internal wind and any kind of pain due to internal wind, then the prescriptions that include points to focus on that would be liver 2 to liver 3, large intestine 4, gallbladder 20, DO 20, UB 60, LI 11, spleen 6, UB 18, spleen 4, UB 17 to nourish the blood, especially the liver blood, and to help expel the wind. So let's move on to cold. Cold B, also called Tong B or painful B, it usually comes with wind, and it can come with dampness. But here in this pattern, the cold is predominant. So external cold can easily invade the body of somebody whose Wei Qi is really frail. And people who are more yang deficient have more of a tendency to be invaded by cold. So cold is yin in nature, and therefore it slows everything down. It slows the circulation of yang qi in the channel, so the yang qi can't dispel the cold and it can't recover. It also causes, it freezes and congeals the fluids and the circulation of blood. And the pain that comes with a cold B is it's a lot more intense than the wind. It's like an excruciating, like a spasmodic kind of pain. If you think about putting your hand into a bowl of water with ice and hold it there for as long as you possibly can, that's kind of like that deep, contracting, awful, nauseating kind of pain. That's pain from cold. It's obviously, as you would expect, it's better with warmth, it's worse at night, and it's worse with cold weather. It's worse at night because at night everything slows down, the circulation of everything slows down, and the yang is at its lowest. So the affected area feels cold to the patient. The joints are really stiff and frozen, and they can't extend or flex, especially first thing in the morning and late at night. So in this case, you're going to have a white tongue coat, and the pulse is going to be a lot fuller. It's going to be tight or wiry. It can combine with dampness, causing the pain to feel really heavy and swollen. So cold and damp together mainly affect the joints of the lower body. So points to get rid of the cold or to warm the cold: DO 14 with moxa. I would say all these points with moxa. DO 14, Ren 8 salt moxa. UB 22, the back shore of the sanjiao. UB 23, back shore of the kidney to fire up the kidney yang with moxa. Moxa cones on UB 43, which is really good for chronic deficiencies. DO 4, Ren 4, gallbladder 39, all with moxa or a moxa box over the abdomen or the lower back. So again, along with these points, think about choosing a combination of local points over the affected area, barrier point, chi clef, chu stream, and like I said, we'll talk more about that later. So the cold kind of B syndrome that arises more from yang deficiency, it can cause a kind of rheumatic pain that is, it still feels cold, and better with warmth, but the onset's going to be a lot slower. and the symptoms are not going to be quite as severe, and they're not going to be like that full external cold that we've just talked about. So I would use probably the same points as we've just talked about, but maybe add something like warming needle on stomach 36, spleen 6, just to tonify the Wei Qi. So moving on to damp B or fixed B, Chuo B, Shi B. So this usually comes obviously with wind, can also come with cold or with heat. But the main predominating factor is that the pain is characterized by heaviness and in some cases swelling. So the dampness is yin in nature, and it's turbid and cloying, and it damages the yang, and it just blocks everything. It blocks the circulation of qi and the circulation of the other fluids around. So it comes with a feeling of heaviness and swelling and tiredness, and it can also create numbness. The pain is usually deep, and it's heavy and dull. It's not usually sharp, and this is usually, it's not easily got rid of. This is usually a kind of a slow, chronic, disabling kind of pain. It's aggravated by foggy, wet, overcast, humid weather, being in damp environments like in a damp basement or wet, damp places. It can also be internally generated from a failure of the spleen qi to transform and transport the fluids, and also from dietary imbalances. External dampness invades the system as a result of a long-term exposure to rain or a damp environment. It resides in the joints. Think about the node analogy. It's like if the qi in the blood can't get past the complicated structure of the joints, then the dampness is an easy, the joints trap the dampness really easily. It makes the dampness makes the joints swell, and the pain comes with a sensation of heaviness. The skin and the muscles around may also feel numb, and there may be limited range of motion. So, like I said, the pain's worse in damp weather and changes of barometric pressure. It's alleviated by warmth. It's heavy and sticky and can cause more stagnation. It's really hard to get rid of. So the tongue coat is more greasy, and the pulse is going to be slippery. So dampness does damage to the body in that with wind it causes pain in the body that moves around from joint to joint, causing numbness and stiffness and heaviness in each joint. And with cold, it causes pain in the joints that is swollen and worse. I want you to cut that little bit out because I'm kind of repeating myself. So the treatment principle to resolve dampness: unblock the channels, circulate the qi and blood. The points we would use are warming needle on stomach 36, spleen 5, gallbladder 30, gallbladder 34, spleen 6 and 9, UB 22 and 23 for the sanja and the kidney. REN 3, this is where the channels of water metabolism meet. And REN 3 is great for any kind of obstruction of dampness in the lower jiao. UB20, UB28, Sanjiao 5. Let's move on to the last one, which is heat, or which can also transform into fire. So heat can happen as a result of wind, cold, and damp, the initial three, invading the body that already has internal heat. Or it can simply be due to an invasion of wind and damp heat, or an invasion of wind heat. So either really hot or humid weather. The heat causes painful red swollen joints. If you think about inflammatory arthritis like gout, the pain's really intense. There'll be a resistance to pressure. There may be a contraction or like a tightness of the sinews and the vessels, because the heat injures and eventually dries up the fluids and thickens the blood in the channels. It's better to be cold. It comes with irritability quite often and thirst, and it's often worse at night. And it's better with movement. So the tongue is going to be more red, and it's going to have more of a yellow coat. If it's like a damp heat, then obviously it's going to be a thick, greasy coat. And the pulse is going to be rapid. So the treatment principle would be to clear the heat or the dampened heat, invigorate the qi in the blood, So using the Yang Ming points and the points on the Do channel to clear the heat, LA11, stomach 44, Do 14, the meeting of all the Yang channels, LA4 for pain everywhere, spleen 10 specifically for heat in the blood, liver 2, spleen 6. Lung 7, kidney 6 opens the Ren channel, which affects the yin and helps protect the yin. And Li1, bleeding Li1 will clear heat from the Yang Ming. Si3 UB62 will open the Du and the Yang Chao Mai, which also expel excess Yang from the body. And then with that, a combination of local Shi cleft shoestring points or her C points that are specifically pretty cooling. So external heat can be combined with internal heat, which can come from either like an imbalance in the internal organs, like yin deficient heat or kind of stomach heat, an overindulgence of heating foods, long-term emotional stagnation that can transform to heat or fire. So in general, heat is it's a destructive pathogen in that it consumes the yin and the fluids and it dries the blood, leading to blood stagnation, which can then cause further stagnation of everything. The heat or internal fire can generate internal wind. The heat or dryness heat or fire can dry internal dampness into phlegm. It kind of condenses the fluids. It burns off the excess fluids. So it makes the dampness even stickier. And all of these can lead to further stagnation. So if the above pathogenic factors are the ones that we've talked about, penetrate the body to a deeper level than just below the skin, if they're not resolved, then they can invade the bones and the joints. So the long-term stagnation in the joints can then create even more heat, which can then transform dampness into phlegm, further obstructing the circulation and creating these bony deformities that we talked about, the blood tarring, that are characteristic in advanced arthritis. This stage is called bony B. So this is the most chronic of the B syndromes. It comes with, as we said, it comes with deformities and more stiffness of the joints. It comes with a long history of recurrences of joint pain. Chronic B syndromes of any nature obstruct the flow of qi and blood with the presence of the pathogenic factors and cause the stasis of blood in the phlegm, which then settles to the depths of the joints. So that this all forms nodules, which then cause even more obstruction and causes the qi and blood to no longer be able to circulate. And it can kind of cause either a buildup of heat or cold beyond the space of the joints. The range of motion is really, at this stage, pretty severely impaired, and the pain can either be excruciating or there can be no pain at all. The joint can either feel cold and stiff or red hot and swollen, and it can be aggravated by cold and damp weather or by heat or any kind of barometric changes, although because the joints themselves, the structure of the joints has changed, and there's the bony deformities that are blocking the circulation of qi and blood, sometimes the weather doesn't even make a difference because the deformities are already there. So the pain can actually be constant. So usually when somebody's got to the stage of bony B, the tongue is going to look a lot more stagnant. It's going to be darker and more purplish. There may be a choppy or a slippery pulse. There's going to be probably accompanying signs of kidney deficiency. So treatment principle here, you want to clear heat or cold, invigorate the blood, unblock the channels. So points specifically to affect the bones are UB11 and gallbladder 39. My experience of these points, they don't actually do as much as I would like them to do, put it that way. I find with something like, say, osteoarthritis, which we see a lot in the nursing home, actually just surrounding the joints really helps. So I'll put in ear needles around the knuckles, combination of Bassier, Bafang, Sifang, And then to affect systemic changes, like to kind of help with the phlegm and just a general chi, stomach 40, stomach 36. And again, the shoestring points are the local points and the chi clef points. So DJD, rheumatoid arthritis, osteoarthritis, osteoporosis, these are all classified as bony bee syndrome, where there's an actual destruction or an actual structural change in the joint cartilage, or some people say they just, they looked on an x-ray, there wasn't any cartilage left at all. Any kind of bone modification with some pre-existing kidney deficiency would qualify this to be diagnosed as a bony bee syndrome. So to recap, as a rule, the following pain patterns are going to give us vital diagnostic information. A heavy kind of pain with swelling is we're going to be looking at a predominance of dampness. Cold pain, worse with cold, better with warmth, is either going to be an invasion of pathogenic cold or a yang deficiency. A latent or a hidden pain, it's like that kind of feels like it's a constant but niggly and deep pain, is usually due to some kind of interior deficiency, either of blood, qi, or yang. A stabbing pain is usually blood stasis, but can also come from bony bee syndrome. Pain with fatigue, accumulation of dampness, especially at the muscle level. A violent pain, which is like an intense contracting pain, is usually due to an excess cold stagnation. A spastic, some people describe it like it's like a pulling pain, like a tendon, like it's pulling the tendons. That's usually due to a liver, blood, or yin deficiency. A pain that moves around or random kind of comes and goes is either going to be more wind or chi stagnation. So I want to move on to talk about treatment protocols used in bee syndrome. So obviously everybody's got their favorite protocols, and there are many, many combinations and classifications of points to help with rheumatic conditions. But I find the most effective point prescriptions are those that include distal points and local points to break up the obstruction, as well as points to chase out the pathogen that's invaded, and some kind of tonification. So the following categories of points have been found really useful. Obviously, Ashur points, which are just simply points on the channel or even off the channel, not that aren't particular acupuncture points, which are just points where the patient feels pain. You can just use techniques to surround or just needle very superficially around these Ashur points. Local points to break up accumulation. So these are points located on the meridians where through which where the pain presents. So I want to just give you a list of the most commonly used local points. So for the neck, gallbladder 20, UB10. For the shoulder, LI15, LI16, Sanjiao 14, and Zhenqian or Zheneling. For the elbow, LI11, lung 5, heart 3, Sanjiao 10, small intestine 8. For the wrist, Sanjiao 4, large intestine 5, lung 9, heart 7, small intestine 4 and 5, and pericardium 7. The fingers, Baxier and Sifang. For the lower back, UB 22, 23, 24, 25, UB 31 and 32 for more sacral pain, 27 and 28, and do 3 or do 4. For the hip, gallbladder 30, gallbladder 29, and the extra point Tunzhong. For the knee, Heding Xian, liver 8, kidney 10, gallbladder 33, and UB 40. For the ankle, spleen 5, stomach 41, LI 11, gallbladder 40, kidney 3, and UB 60. For the toes, Bafang. So another way we could actually, if you don't want to go into the joints themselves, when somebody comes, especially with arthritis of the knee, when somebody comes for the first time, I'm very reluctant to actually go directly into the joint. So what I usually use to start with is adjacent points points that are close to the area, and in some cases actually surround the area. So like for the neck, we'd be talking about gallbladder 21, do 14. For the shoulder, SI9, SI10, 11, 12, 13, 14, or 15. Gallbladder 21, LI14, Sanjiao 13. For the elbow, LI9 or 10, 12, 13, or 14. For the wrist, Sanjiao 5, lung 7, pericardium 6. For the fingers, Sanjiao 5 and pericardium 6. For the hip, stomach 31, UB 36. For the knee, stomach 36, spleen 9 and 10, stomach 34, gallbladder 34, or liver 8. I often find gallbladder 33 really useful as well for the knee. For the ankle, kidney 7, gallbladder 41, UB 59. And for the toes, spleen 3, UB 65, and liver 3.
Angie, could you
Yeah.
take a moment to tell us why you don't like to directly needle into the affected area on that first treatment?
My experience when I started off as a practitioner was sometimes the knee joint specifically is pretty unstable. And especially with the elderly, whenever you put a needle in, it can actually bring more qi and blood, or rather more blood and fluid to the area. So going directly into a joint that's already inflamed, it can actually cause more stagnation. This is something that I've found more with the elderly than in a younger population, because like we're talking about before, with an older population, they don't tend to have their own kind of mechanism. There isn't enough qi and blood to keep everything moving. So when you put it's quite often people will have an aggravation of low back pain as well. If you just jump right in and do local points, because they bring in qi and blood to the area, and if you're not using any distal points or anything to kind of break things up, it can actually cause more of an accumulation. What I tend to do, if people don't have an aggravation with the adjacent points on the first treatment, then I will go in and do more local points. But to start off with, I don't usually like to jump right in and get into the area where there's already inflammation. So let's move on and talk about barrier points. So this is a collection of points that are used in rheumatology that have been chosen both are either because they have the word barrier or gate in their primary or secondary names, or because of their assigned indications in traditional texts. So the idea of barrier comes from the idea that the joints, again, like we talked about, are like an obstruction, a place of obstruction. They're a barrier or a gate, and they can become obviously then a barrier to the flow of qi and blood. So the barrier points are located primarily around or downstream from joints that need unblocking or opening. And the most common ones that I've come across are for the shoulder, small intestine 11, large intestine 15, lung 2, and pericardium 2. For the elbow, Sanjiao 13, Sanjiao 7, and heart 6. For the wrist, large intestine 9, SI6, pericardium 4, and lung 6. For the hip, gallbladder 29, stomach 31, spleen 12, and liver 11. For the knee, gallbladder 33, gallbladder 36, and kidney 5. And for the ankle, stomach 37, UB 63, liver 6, and spleen 8. So distal points, moving on to distal points. These are the points below the elbows and the knees that affect the major joints further up on the channel. I was reading Giovanni Maciocia, and he likes to see them as points that open the channel to start a treatment, and they help to expel the pathogenic factors. So they're often chosen on the channel where the pain is presenting, but some distal points can also be used to affect other channels, like commonly used like in the mirror system. For example, spleen 5 can be used for wrist pain. So distal points for the neck, we will be looking at lung 7, small intestine 3, gallbladder 39, Sanjiao 4, and Sanjiao 8. For the shoulder, Sanjiao 5, Sanjiao 8, lung 7, stomach 38. For the elbow, Li4, Sanjiao 5. For the wrist, spleen 5, gallbladder 40. For the hip, gallbladder 41, UB62. For the knee, spleen 5 and SI5. And for the lower back, UB40, UB60, UB62, and UB58. So moving on to the chi cleft points. So this is where the chi of the channel accumulates. And they're used to kind of give an extra bit of a kick to a treatment. They kind of used to move chi and blood in excess cases. So the chi cleft points, as we know, lung 6, large intestine 7, spleen 8, stomach 34, heart 6, small intestine 6, UB63, kidney 5, pericardium 4, Sanjiao 7, gallbladder 36, liver 6. UB59 is the chi cleft point of the yang chao mai. Kidney 8 is the chi cleft point of the yin chao mai. Gallbladder 35 of the yang wei mai. And kidney 9 for the yin wei mai. So shu streams, these are interesting points in rheumatology, and they're used a lot. According to channel theory, the shu stream point is where the chi of the channel starts to pour. So it's here that the channel, it gets wider and it gets deeper. So it has more systemic effects. And also this point is right at the midpoint between the Jingwell point and the Hersey point. It's the third point of the 5 classic points. So it kind of acts as a fulcrum and a balance. It balances the interior with the exterior of the body. So at the shu stream points, the defensive chi is pretty strong. It gathers here, and it's the job of the shu stream point to kind of kick out the pathogen before it actually gets into the interior. Shu means a boat or transport. So it's kind of literally, if you think about it, like it's here where the stream is strong enough to allow the outside pathogen to kind of jump in the boat and ride on its current to the interior of the body. Also, the shu stream point on the yin meridians is the earth point, and it's also the yuan source point. So they also have like a nourishing, a tonification effect on the associated organ system. So I've been reading Whitfield Reeves, and I totally owe this little piece to him. He has a particular way of using the shu stream points. His book is called The Acupuncture Handbook of Sports Injuries and Pain. And I was interested to see how he uses the shu stream points for more chronic, lingering joint pain. So he chooses the shu stream point as a distal point to the injured channel. And he uses that's on the affected channel on the same side. And he pairs that with the shu stream point of the paired 6th division channel on the opposite limb. It sounds a bit complicated, but I'll give you a couple of examples. So this is the opposite side to where the pain is. So this basically means that there's 2 shu stream points, one on a lower limb and one on the upper limb. So for example, if you have pain, say, in the anterior shoulder, like on the large intestine channel, he would use large intestine 3 on the affected side, and then stomach 43 on the opposite side. So another combination for pain on the Sanjiao channel, he'd use Sanjiao 3, then he would on the affected side and pair that with gallbladder 41 on the opposite side. For pain on the small intestine channel, he would use SI3 on the affected side, paired with UB65 on the opposite side. So other combinations that you might want to play around with: stomach 43 and large intestine 3, gallbladder 41 and Sanjiao 3, which is a different way. We used to seeing gallbladder 41 with Sanjiao 5 always. UB65 with SI3, lung 9 with spleen 3, pericardium 7 with liver 3, heart 7 with kidney 3, spleen 3 with lung 9, liver 3 with pericardium 7, and kidney 3 with heart 7. So I want to move on to the Jing River points because these are points that are also specific for rheumatic conditions. These are the points, again, like according to channel theory, this is where it's further up than the shoestring points, and it's where the qi actually leaves the meridians and it flushes into the surrounding tissues, into the sinews and the joints, and it kind of irrigates the surrounding tissue. So if a pathogen has invaded the meridian and it's kind of bypassed being kicked out at the shoestring point, it can get off here, get off the stream here at the Jing well point and invade the surrounding tissues. So the Jing River points allow access to the joints, and they're specifically used as a kind of second line of defense to treat rheumatic conditions, to treat the pathogenic factors as they're kind of making the way up the channel. It's specifically used for rheumatic conditions and also for paralysis and for spasms. So the Jing River points on the lung channel, we've got lung 8, we have stomach 41 on the stomach channel, heart 4, UB60, pericardium 5, gallbladder 38, LI 5, spleen 5, small intestine 5, kidney 7, Sanjiao 6, and liver 4. So talking about specific techniques and kind of point combinations. So some people, some practitioners, obviously everybody's got their favorite way of doing things. Some people like to start needling and dispersing the distal points on the channels first to attract the qi away from the points of pain. A little bit like I was saying, like I wouldn't want to go directly into somebody's, into local points, into somebody's knee when they have some kind of inflamed rheumatic condition. So if you start needling and disperse at the distal points to actually attract the qi away from the point, and then you can needle locally. This is kind of particularly applicable in more excess, acute excess conditions. What is often seen is a 3-needle technique, like for the shoulder, for example, Li 15, Sanjiao 14, Gentian. For the neck, Anmian, bilateral Anmian, and Du 14. For the knee, Xian Heding. For the ankle, stomach 41, spleen 5, gallbladder 40. But remember that I think the most effective treatments are going to be those that include like getting rid of, expelling the pathogenic factor that's kind of lodged in whatever level of tissue that you're looking at, and then doing distal points, local points, and then some tonification points to actually work on bringing up the wei qi or the organ that's been affected. So apart from the usual dispersion and tonification, there's the following techniques have been mentioned by other practitioners treating B syndrome. For muscle B, some practitioners use 1 needle right in the belly of the muscle to be effective with 2 needles placed obliquely either side, and then using a strong dispersing technique. So you have 1 in the middle and then 2 and very, very shallowly obliquely inserted, and then using very strong dispersing. And then for a muscle spasm or for a cold B, threading 2 needles superficially and oblique to affect the superficial muscle fibers to relieve a spasm. Or you can just put 1 needle right in the middle of the pain and like 4 needles around, 4 or 5 needles around, like it kind of surrounding the dragon. For bone B, some people can insert the needle right down to the bone and do like an up and down technique, manipulating the needle up and down. So each time they go down, they're gently touching the bone. At this point, I'd really like to talk about a couple of cases to kind of highlight. The first one, talking about muscle B, and the second one's going to be bony B. So one of my jobs as teaching faculty for Bastyr University is I've been working at a refugee clinic at the Seattle Public Hospital called Harborview Hospital. And the refugees that come for treatment, they've all come over to to the States, to Seattle. They come mainly from Somalia, Ethiopia, and Vietnam. Those are the three biggest populations we have. So within the department, we also have like a torture clinic, and it deals specifically with survivors of sexual, emotional, and physical abuse. And most of the people that we see are women, and I would say 80% of them are Muslim, and they're shrouded, and that's kind of significant. We'll talk about that later on. So the thing that over the last 12 years, there's been a kind of common thread that I've been seeing, that the women, especially from the African countries, they seem to present with these symptoms, and they're all really similar. There's like this kind of common thread of muscle B. And they all come with, I mean, initially there's this, the first significant thing about it is that there's no Western medical diagnosis. But they have these things in common. The pain that they present with is usually all over the body. They come in and they say, where's your pain? And they point to the head, then they go down the shoulders, then they go down the back, then they go into the legs, and then they make their way up to the knees and the hips and the trunk. They all have a history of multiple childbirths, some women having had 11, 12, 13 children. They all have a history of really poor nutrition, or in some cases malnutrition. They've all been living in hot climates, and many of them, most of them, are shrouded, as I said, which when they come to the US, I mean, in their own country, it prevents an absorption of vitamin D, but when they come to the US, and especially to the Pacific Northwest, where there's very low vitamin D, there's not a lot of sunlight, they usually come, they're very, very depleted. They have a major vitamin D deficiency. And one of the most common things is that their muscle pain begins when they arrive in Seattle, but whenever they go back home, it resolves. So the women have also all been subjected to severe physical or emotional trauma. A lot of them, well, I would say all of them, have come to Seattle as refugees, like I said, and they all have some element of PTSD. And nothing ever really shows up either on an MRI or on X-ray, but they all have exactly the same pain presentation. This has been a really amazing opportunity for me to see how TCM kind of so beautifully describes like a situation like this, where there's like a real kind of complex development of a disorder that has its roots in poor nutrition, emotional, physical trauma, multiple childbirth, environmental factors. So all the things that we've talked about today, all the different etiological factors, all present in this kind of beautiful package with these women in this clinic. On top of that, the women all present with fatigue, lethargy, pain, and like kind of that, you know, heavy, like damp kind of pain. In their own country, they're used to walking a few miles every day, either to get water, or they're used to kind of working on farms. But as refugees in the US, especially since 9/11, there's so much hostility on the streets against Muslims. They don't feel safe just walking the streets. They've kind of lost their community. They don't have the language skills. So outside of the homes, they feel pretty vulnerable and fearful. So in TCM terms, we have this combination of factors, right, that has depleted the kidney qi, as well as lack of proper nutrition and exercise that has also stagnated the qi and drained the spleen qi. And all these factors together have kind of created an open door for the invasion of wind cold damp, which is pretty endemic in Seattle. So the wei qi deficiency, qi stagnation resulting from emotional factors and trauma, lack of exercise which doesn't allow the body to move or expel the dampness, it all settles in the muscle layer, affecting all the channels of the body. Now eventually these pathogenic factors over the next few years, if they don't get thrown out, will probably eventually settle into the joints and cause heat and possibly the blood tarring that we talked about earlier. But at this level, the level which I see them, which they're relatively new refugees within like probably the first 4 or 5 years of arriving in this country, most of the pain is actually on the muscle level. So we're diagnosing a muscle B. At this level, I've found cupping to be really useful. Cupping breaks up the stagnation in the space between the skin and the muscles, where the small connecting vessels are residing, where they've trapped the pathogen. It helps release the pathogenic factor. And that with a combination of damp draining points and spleen and kidney tonification points and local points to move chi, this all attacks all aspects of this condition. In theory, moxa would be great for these women, but unfortunately at the public hospital, we're not allowed to use moxa. So I want to talk about a specific case. So Safia is a 56-year-old woman from Somalia. She presents with back, hip, leg, and shoulder pain, anxiety, and insomnia. She's Muslim, and as a result, she's shrouded. She has a small, very pale tongue, and dry tongue, has a really red tip and red edges. The pulse is deep, and you can actually barely feel it. And you've pressed down, and it just totally disappears. It's deep and very, very faint. So she's had 6 children. She has a history of spousal abuse, poor nutrition, and severe PTSD. She came to Seattle in 2001 when her village was under siege and her husband and her eldest son were murdered. So her muscle pain started within the first 6 months of arriving in Seattle, which is a common theme. Heat and pressure make the pain better. Walking and sitting for a long period of time makes the pain worse. Her lower legs, her knees and her ankles are really swollen. So she doesn't say that she has pain deep in the joints. She feels it's more in the muscles, or she calls it in the nerves or in the tendons. So looking at the developments of this pathology, the combination of the shock, the long-term fear, that combined with excessive childbirth have all but drained her kidney chi. The anxiety of being displaced and isolated has damaged the heart and stagnated the liver. So most nights she has nightmares, and she has a history of chronic insomnia, which means that some nights she doesn't even get to sleep. This has drained the heart and kidney yin. When she arrived at our clinic in Seattle, like a lot of these women, her vitamin D level was very low. And despite living in a climate, like I said, because most of her life, they weren't even these women aren't even allowed out of the house unless they're totally covered, causing a vitamin D deficiency from lack of sunlight. So plus malnutrition. So we diagnosed Safia with cold damp B syndrome, specifically muscle B with spleen and kidney deficiency and heart and kidney disconnect. So when she first came into the clinic, we did adjacent point for the knees, spleen 9, stomach 36, stomach 34, spleen 10, liver 8. We did points to drain dampness, tonify spleen, spleen 3 and spleen 6. And we did local points for her back, UB 22, 23, 25, 28, and 32. So when she came back, she reported that her pain was relieved for a few hours after the treatment, but came back the same evening. On the second treatment, which was a week later, we added yin tongue, Ren 17, Ren 14, Ren 4, and kidney 16 to help with the anxiety and the heart and kidney disconnect. After this treatment, her anxiety and spirit was like transforming. It was so much better. The addition of the heart points really helped with her sleep, which then helped with her overall energy and the draining aspect of the anxiety. On the third treatment, we added cupping, which is what really cracked this. It kind of brought the most relief of all. So she got relief for almost a week after adding the cupping. So in just 3 treatments, a lot of Safia's body pain was relieved. Her sleep and anxiety continued to improve. So catching the cold, damp pathogen at the muscle level before it got to the joints is key to providing the blood tarring and the structural changes to the bones and the joints and the progression of the arthritis. I've been seeing her now for years, and she comes back on every week or every 2 weeks, every 3 weeks, whenever she can get to the clinic, and she is doing great. Her anxiety is so much less. Her pain is, it's definitely manageable. She still gets the pain, especially in the winter, in the cold, damp Seattle winter. She still gets the pain and she comes back. But on the whole, she is right from that third treatment when we incorporated the cupping. She's been doing great. So the second case I want to tell you about Toshi, who is a Japanese woman, to 83-year-old, who came to my clinic, not at Harborview, but my own clinic, so I can use Moxa, with lower back and neck pain. She had basically a spinal stenosis. So spinal stenosis, by definition, is a bony bee. We've got the bone, the actual bone of the foramen obstructing the nerves. She is barely 5 foot tall. She has a severe kyphosis, but she plays badminton twice a week. She walks every day, walks 3 miles. In rain or shine, she walks 3 miles every day, and she keeps herself relatively healthy, has a really low-fat diet. She has a great diet. So the stenosis is causing pain in her lower back and her neck, and her fingertips are all numb. So it's hard for her to do anything that requires fine motor control, like buttoning her blouse or kind of sewing, anything like that involves fingertips and sensation. So looking at her back, her thoracic vertebra, when she's face down, her thoracic vertebra protrude posteriorly, and there's very, very little disc space between the lumbar vertebra. I assessed her with Bonney syndrome with a natural decline of kidney essence. And it was amazing to me that despite the structural degeneration of her spine, she had really good results, even on the lower back pain, even from on one treatment. So the first treatment, I did Huato Jejis of the points on the neck, and Huato Jejis of L1 to 5, and then doing UB 22, 23, 25, and GB 30, and then doing points to kind of relax the musculature, like GB 21. I also did the points threaded down the medial borders of both scapula to kind of help with the thoracic, with the tightness in the thoracic area. The key to this woman, though, was Moxa, I believe. It was heat and Moxa. I used a Moxa, before I put any needles in, I used a Moxa box on her lower back, and she loved it, and helped relax the back muscles. And then I did the points that I've told you, and just a very, very simple local treatment, essentially. And even though I've treated a lot of people with this condition, especially with osteoarthritis or like Bonney syndrome, and I'm always surprised that even though there's that structural change in the bone, that we can still get such great results. So far with Toshi, her pain has not actually returned to the original levels since the very first treatment. I've been treating her for 3 years now, and I usually see her once a month, and in the winter I might see her a little bit more often. We always use Moxa. Every day she uses heat, like a heating pad, on her upper and her lower back before and after exercise. And that, with stretching, is totally enough to keep her pain at a manageable level. So far, so good. So the third case I'd like to talk about is something that happened to me recently. I had absolutely no idea. It was while I was preparing for this seminar, to give this seminar, and I got a really bad cat bite. And I ended up I got a cat bite on the Friday, and by the Sunday I ended up in ER because I had cellulitis. I got a cat bite. You can probably still see the actual puncture wounds, and I ended up on IV antibiotics because I got cellulitis from kind of just above the wrist right through to the fingers. And apparently it's like injecting cat poo directly into your bloodstream if you have a cat bite. Who knew? Because they're so filthy, the teeth are so filthy. Anyway, so I went to the hospital, I got the IV antibiotics, and this went down within 24 hours. I was great. And then I went on oral antibiotics, Ceflex, for a course of 10 days. So after about 2 weeks, before I went to bed every night, I would feel my hands and feet start to swell, and my knees, and then it went to my knees, and it went to my elbows. My elbows were the worst, and they would be red hot, what I call, like classic rheumatic swelling. And basically, what I've been doing, what I figured was that the initial heat toxin was then cooled off by the cold, damp nature of the antibiotics. But because the cold, damp obstructed the joints that were already obstructed, and also probably because I'm a little bit Qi deficient, and I have a tendency to dampness anyway, I ended up with swelling, and it's usually at night. So when everything calms down, when my circulation is kind of slow, I get these hot burning joints. So this would be seen as like an acute invasion of wind damp heat in Chinese medicine, and points that I've been doing on myself, which I shouldn't do, but actually other people I've seen two other practitioners, but so Li11, stomach 44, and then the points to surround the joints that we talked about before. So all the points in a row around the elbow joint, heart 3, P3, lung 5, Li11, and then around in the ankles, which were the worst, spleen 5, stomach 41, gallbladder 40, Bafang, Bashi. I have had a lot, and it's eventually starting to calm down now. But it's just really interesting to see that these symptoms can also come on acutely, although we think of rheumatic disorders as being more of like a deficiency and excess, like a kind of a long progression. There's also an acute invasion of wind damp heat evil that can happen, that can just flare up your joints completely. Of course, when I went to the doctors and said, I believe that this is a combination of the original toxins that have stayed in the joints because they're these natural obstructions to my flow of energy, and that in combination with the antibiotics, and I was kind of poo-pooed. And they just said, yeah, go there, and this will wear off. When I looked at, if you look at what I find interesting is when you look at the contraindications and the actual the side effects of any kind of medication, every medication has an energetic quality. And I was looking at this medication on Cephalex, and it said can cause drowsiness, nausea, vomiting, joint pain, swelling of the limbs. What is classic cold damp? So on top of an already damp condition, adding cold damp, anything energetically, is going to then suppress the spleen, which is then not going to be able to kind of help move those invaded pathogenic factors. So that's me. I'm doing much better, and I'm a hell of a lot better off than my refugees are. So that's all I have to say.
Thank you for that. That's such a fascinating talk, and it was interesting to hear you sort of talk beyond treating the elderly to obviously treating different populations and other sorts of conditions. I've just got a couple of questions for you, Angie. One of the things you highlighted when you were talking about Toshi, and it touched on it just when you were talking about your own situation there with a cat bite, was when would you recommend that somebody do exercises versus when would you recommend perhaps they rest, if what you're saying is the idea of toxicity building up in the blood and not wanting to circulate that further, versus a condition where with stiffness, is that something that you would support somebody?
I think part of the problem with a lot of, especially acute cases, is that people don't move. I think doing gentle stretches, and also, I don't know about circulating the toxins, but what we really want to do is keep the qi and blood moving to move through those barriers. So I think if somebody can do it, like Toshi, I mean, like doing a good few miles a day. And in my situation, I was still walking, and I was still trying to flex and extend my arms, partly because I couldn't believe that I had this condition, but also just to kind of keep things moving, because you don't want those toxins settling and creating more of an obstruction. And then because when you get that, like we talked about before, when you have the dampness, and then any kind of obstruction is going to create a frictional heat that's then going to make the fluids even more sticky, and then that's going to create even more of an obstruction. So I would say always do, as much as you can, do some kind of gentle exercise and stretching, walking, just to keep your chi and blood flowing and get movement through the joints.
And you also mentioned with Toshi, the case of Toshi again, that she was using a heat pad. What sort of other things do you use? Do you advise people to do at home when they've got these sorts of conditions?
Always
What can
heat,
people do for
always,
themselves?
always. Unless they have something like, if they have gout, then I would not use heat. But part of the issue is that gout quite often, something like gout there's not a lot of true cases of hot bee or damp heat bee. Quite often you have a cold damp bee in a joint that then, because of either liver qi stagnation or spicy food or a flare-up of fire from kidney yin deficiency, will flip that cold damp into an inflammatory state. So like the classic one is gout in the big toe. You go out and you have whiskey and a vindaloo, and you'll end up with a flare-up of the gout, right? So very, very rich kind of damp heat producing foods will then flip the condition into an inflammatory state. Could you remind me of the original question?
Oh, it was just talking about with Toshi was using heat pads.
Oh yeah,
and just,
yeah.
Again, what advice can you give patients to do at home outside of coming to see you for treatment?
Yeah. So even with sometimes a damp heat condition, moxa can help. So giving them a moxa stick so they can do it themselves, or heat, unless they know that it absolutely, I mean, some people will say like, when I put heat on my back, on my lower back, it really aggravates things, either because it relaxes the muscles too much or just because they have a kidney yin deficiency. So what you don't want to do is obviously aggravate the situation, but usually back pain, muscle pain, most of these are coming from a wind cold damp. So heat, give them a moxa stick. Most of my patients take moxa sticks home with them. They can do it themselves. And hot baths, Epsom salts baths to help to relax, like loaded with magnesium, obviously to help relax the muscles. And exercise, gentle exercise. The problem with people like we're talking about before, people who have pain, they don't want to move, and when they don't move, the muscles get weak, and then the muscles can't support the structures. And then somebody with chronic low back pain from an injury, and then the injury gets better, and if they don't move and they don't kind of keep working on exercising and strengthening the back of the core, the next time they sneeze or pick up an apple or something or feed the dog, put food down onto the floor, it's so easy to actually throw the back out again. And part of that is the kidney, because kidney is the palace of the lower back, but also it's the spleen. It's the spleen not being able to, the muscles get weak, the spleen gets weak, and there needs to be enough chi in the muscles to be able to support the surrounding structures. So yeah, exercise, heat, definitely. Moxa, exercise. I said that twice.
That's great.
Gentle,
yeah. You've just talked about the vindaloo and the spicy foods aggravating things. You mentioned diet as being important, but could you elaborate that? I know that there's a lot of the body of evidence around vegan or low fat animal products. As obviously trying to avoid animal products seems to be the new way of addressing rheumatological problems. Have you got any thoughts on that?
I think it would make sense from a TCM point of view if you're not overloading your system with fat, because all fat is damp and phlegm creating foods. So eating really lean diets would make sense. However, the other side to that is if part of your condition, if part of your constitution is that you're coming from like a blood deficiency, which is allowing this invasion of wind, for example, then you need to be really careful, I think, to be eating. People who are vegan have to be very careful that they get in the proper nutrition and eating enough blood-building foods. For some people who have a spleen T deficiency and the blood deficiency, because one usually leads to the other, it's really hard for them to make new blood from when they don't eat blood foods. So people have to pay a lot of attention to the diet in that way. But yeah,
wheat products. Have you got any thoughts on wheat products and their
the
yeasts?
Yeah, I mean the thing about wheat is that it's like, wheat and sugar are both inflammatory foods. So any kind of condition is of damp heat in the joints or even dampness in the joint, whenever you kind of pile wheat on top of that, it's wheat in itself and sugar are both damp and heat. They create damp and heat in the body. So if you have a tendency to stagnation, then the inflammatory foods are going to make things much worse. Um, I remember seeing somebody, oh, 5, 6 years ago, this young woman, she was only in her 30s, and she was diagnosed with lupus, and she had the worst joint pain, a really big swollen, like elbows and knees, and I treated her with acupuncture, of course, and moxa, and the usual things, spleen 6 and 9, and kind of surrounded the joints, and she kind of did okay, but I recommended that she had a total gluten-free diet, and that she stayed off meat temporarily, anything that was and it created any kind of phlegm or stagnation. So we're talking the usual dairy, sugar, wheat, and it was transformative. The moment she was on methotrexate, which also that you need to have regular liver function tests with methotrexate. It attacks the liver. And she was also on a drug called Humira, that's specifically for RA. And she was on it's Enbrel, and she was on Enbrel injections once a week. This woman was in her 30s, and we got her off all her medications with just, I believe, partly the acupuncture, but also like the change of diet, cutting out the foods that created damp and heat, the sugar, the gluten, the wheat, and the dairy that creates the phlegm and the damp. So it definitely, I'm still in contact with her. She's doing great. She's still keeping to that diet. For some people, I think it's enough to reset the body's balances to kind of there's something over here in the States at the moment. It's like this huge kind of trendy thing. It's called the Abiskol diet. It's by a woman called Kathy Abiskol, and she it's a diet that is very, very rich, and for every gram of protein you have like 6 grams of vegetables or whatever. It's like it's a portion controlled diet where you have very few grains, very little protein, but mainly vegetables. And a lot of people talk about obviously losing weight, but a lot of people talk about their joint pain completely disappears on that kind of diet. So yeah, I mean, there's definitely evidence out there to support that. And from Chinese medical point of view, it's all about damp and damp heat.
And do you ever prescribe something like fish oils, or you mentioned the case of vitamin D deficiency, and so therefore would vitamin D supplements be?
Yeah, I mean, these people, the refugees, when they come, they do a blood panel, and they actually give them injections of vitamin D at 10,000 units a day. I mean, they're huge, and also by vitamin B. I myself, for somebody like Toshi, she's on fish oils, or some people find glucosamine really useful. Some people use krill oil. I also advise that they get off all oils except coconut oil, because coconut oil is also an anti-inflammatory, and it can really help with joint pain. It's it's a lubricant, can help with joint pain, helps with memory, helps with pretty much everything. Other things I would recommend. I think for chronic arthritis, the main things are definitely just stay away from the sugar and wheat, the main inflammatory foods.
Great. So we've just been talking about this sort of the internal medicine. Do you then ever look at doing something like liniments? Do you have any thoughts on?
I myself don't. I know a lot of practitioners use patches. I don't actually use too much of that. If I'm doing tuina or massaging anybody, I'll use Posamon or Zeng Shui, but I don't really go further than that. I don't call myself a herbalist, so I'm not as familiar with the patches.
Right. And do you do much tuina? That's my other thought in terms of you've talked a lot about acupuncture and about moxa and things. Is how often do you come in contact with the tactile side of?
I do on my older patients, but very, very gentle. So I don't think it could really be called tuina. Also, one of the main things with working with the refugee clinic is a lot of the women the only touch they've ever had has been pretty brutal. So I work with the students, with the refugees, and part of the treatment plan always incorporates massage or tweener. Some of them love it, some of them can't bear to be touched. But even doing just like very gentle kind of, like lymph drainage, like kind of working with the lower leg, trying to do some just very gentle touching and trying to stimulate the lymph. They like that, and they find it quite, I think it's quite useful. I get my students to do the tweener more than I do it myself. But with my older population, yeah, I would say I do more gentle massage because they're too frail to have a lot of the techniques.
That's wonderful. My very final question for you is, are there any acupuncture points that have surprised you? You mentioned there were a couple that disappointed you along the way. So have there been any that have just turned around and been the ones
Gallbladder 33. I love gallbladder 33. Gallbladder 30. Well, I'm an extra vessel freak. I love using extra vessels. So even those 8 points I would use on absolutely everybody, because I believe that those 8 points they can be used for pretty much every condition, because they cover every plane of the body, the front, the back, the inside, the outside. The chong is like the deepest, most precious vessel. The do for the back and the, I mean, they kind of, like I said, those 8 points, over my years, I incorporate them more and more, mainly because I'm working with a population, a lot of whom are in wheelchairs. So I actually concentrate more on distal points. So a lot of people, I can't get to the hips, or I can't get to the buttocks, where the hip pain is. So I'll use gallbladder 41, Sanjiao 5. But the one that I've been using on absolutely everybody more recently, over gallbladder 34 is gallbladder 33. Because gallbladder 33 it releases the IT band with gallbladder 31, and really helps with circulation in the whole of the leg, and it helps with condylomalacia patella, working with the yin chow and the yang chow. So UB65 kidney 6 with gallbladder 33 also helps. It releases the IT band, so it takes the pressure off the hip, and also it stops the knee being pulled out laterally. That's been one of my most surprising and I think most successful points that I use in all these conditions, for knee pain, for hip pain, and like for sciatica pain as well. I actually use that more than gallbladder 34.
That's wonderful. Look, unless there's anything else you'd like to add or share, you've covered a huge amount today. One of my favourite questions I like to ask people is there something you do now that you would that you do differently than when you first started? And if you could say to your former self, this is the shortcut, what might that be?
I think the extra vessels. I think I really have become a fan of the extra vessels, partly because of the population I work with, like I said, and mainly I also did a lot of community acupuncture. I set up a community acupuncture clinic with a business partner, and I worked that for 3 or 4 years, and we were doing all distal points. So the other ones, the contralateral points, I also find really useful. I think at the beginning I was stuck more on doing the most common points that I'd learned, like Summit 36, Spin 6, Ren 4, which I still use, the favorite go-to points. But working more with the extra vessels and also the distal points, and like Richard Tan points, we see a lot of heel pain and plantar fasciitis at the nursing home, and also at the teaching clinic as well. So using extra points like Richard Tan points for that, I find really useful. It kind of pops into my mind because we used Richard Tan almost exclusively on a teaching shift last night. He's great. I really like the stuff that he comes out with. Can you talk us through
what you might do with the Richard Tan?
Yeah, more kind of like with the heel pain that came in last night. It was plantar fasciitis, mainly presented in the heel. So we threaded. It's one of my favorite treatments for this kind of condition. UB59, UB60, UB61. So thread them down one side of the Achilles, kidney 7, kidney 3, kidney 5, down the other side of the Achilles, and then UB57, and then did Muguan and Guguan, which are 2 points actually on the heel of the hand that relate to the heel of the foot. Because I find, especially with the elderly, with the more frail population, I don't want to needle right into something that I know is going to be really painful. So I'll try and find a different way of doing it, like using contralateral points. So it's easier to have points on the palm needle than points on the heel, for example. It feels more comfortable. So I'll try and use those when I can.
I've just finished editing, and I didn't realize there was so much activity, but there was a program set up in the Service and Treatment for Rehabilitation of Torture and Trauma Survivors in Sydney, Australia. And I've just finished a 1-hour webinar on looking at acupuncture for torture and trauma survivors. So I'll let you know as soon as that's released.
Oh, I would love to hear. See, that's something that I want to do more of. I've been working with that population for the clinic started about 11, 12 years ago. They incorporated acupuncture, and I was the first supervisor of that shift. And I kind of jumped from being working with geriatrics in a nursing home that was built mainly for nuns, right? That was kind of out of my comfort zone. And I thought, well, this is interesting, and became good friends with all the nuns because they're so adorable. And then went from that to working with all these Somali women and, these torture survivors. And it was like, holy crap. What really blows me away is how the human spirit can actually endure some of the stuff that they've been through, And it is the most amazingly rewarding experience I've ever had, because you're working, it's a little bit like when I was working with addicts at the Needle Exchange in London. You're working with people who've never been given any attention, who've never really had a lot of nurturing at all, and then when they get it, they're so grateful. When you actually start to see when they come in, they're usually really guarded and grumpy and angry, and as you would be when they, knowing what they've been through. But then actually when you kind of work with them, they just soften. And I mean, I have so many Ethiopian baskets in my house and trays of little bits and bobs that people have brought me, and because they have absolutely no money, but they can bring you little gifts, as a token of appreciation. And I just need to waffle on for a minute because it's my favorite topic. But there was this one time when I broke my toe, and I still went into clinic. It was my toe got run over by a wheelchair at the nursing home, and I got a dislocated fracture of my little toe. And then I went into I was in a boot and a crutch, and I still went into work to Harborview, to the refugee clinic. And this woman just looked at me and she got hold of my hand and she said, in broken English, she said, "Have I not suffered enough that you should be in pain?" And I thought that was so amazingly humane. She thought that she'd taken on so much suffering that for people like me, I would have, my life would be easy. And then when she saw me in a boot, she just burst into tears. It was so sweet. I mean, these women are just incredible to work with. Oh, I've lost you.
No,
no.
So I've just absolutely wrapped.
Yeah,
I would. I'd love to explore that further with you. And as I said, we've just recorded a presentation on working with torture and trauma survivors. So I'd love for you to see that, and then perhaps we can look at doing another expansion on that, or
I would love to
working with vulnerable people. Maybe doing a broader topic, looking at all your expertise from working with the with drug dependent patients, as well as looking at some of the similarities, looking at damaged spirits and how you might take on those patients. And
that would be an interesting thing to actually put into words, because it's I can do it in a conversational way, but it's hard to do it in a kind of electric therapeutic way somehow. But
we could always do a recording like as we're doing now. We can organise a time that we can sit and have a chat for an hour. And I'd just love to hear your thoughts on it. And if we choose to make something of it, that's great.
That'd be great.
Just wouldn't that be? So look, I'll let you go now, because I know it's exhausting presenting to your computer screen for 2 hours. And
it's also probably past your bedtime as well.
Yeah, I think it's just on midnight.
Right. Well, thank you so much for this opportunity.
No, it's fabulous. It's really just loved it. So thank you for being such a wonderful presenter.
Here comes a blue angel. I'm just going to let that go by. Okay. So also the kidney essence
And
is...
Angie, just saying, just your, sorry.
Yep.
Oh, I didn't mean to interrupt other than just because the interruption is saying it's fantastic. The audio is coming through perfectly clear. So as you are, it's fabulous.
Okay.
Thanks. I'm doing myself up again. I just thought I'd give you a little pep talk as we were going.
All right, thank you.
Just to let you know. Thank you again.
Okay, great. When we think of B syndrome or like any kind of painful obstruction, I'm going to take a break for a second. Bye-bye, Blue Angel. But most people presenting with B syndrome present with a combination. I feel like I'm in a racetrack. 1 second.
I hope you enjoyed this free webinar. Please take a moment to subscribe to our YouTube channel and please share on social media. The world will be a better place when more people know about the benefits of acupuncture.